Kelly is a 26-year-old paralegal whose alcohol use has gradually escalated since college. Kelly has noticed the need for greater and greater amounts of alcohol to obtain the same desired effect. This has caused Kelly to use amounts greater than intended and caused embarrassing behavior at a recent office party. Kelly has attempted to control the amount of drinking by designating certain days of the week and/or prescribed time of day on weekends with varying success. At times, Kelly experiences sleeplessness, agitation, and tremor when not drinking daily. This is the motivational interview of Kelly and the nurse.
Hi, my name is Jessica. I'm going to be your nurse. What brings you in today?
Well, I'm having trouble sleeping lately, and I get shaky a lot.
How long have these symptoms been occurring?
Like a few weeks.
Do they occur all the time, or do you notice that they're worse at certain times of the day?
It's better at times and worse at times.
Do you notice anything that coincides with your symptoms?
No.
The patient is not acknowledging her symptoms as being related to withdrawal. The nurse is rolling with the resistance instead of confronting the patient about her symptoms.
Okay, I'm going to ask you a few questions about drugs and alcohol. Do you smoke?
No.
In the past year, have you had 4 or more drinks in a standard day?
Yes.
In the last year, have you used prescription drugs other than what the doctors prescribed for you?
No.
Have you ever used street drugs in the past year?
No.
How many drinks do you drink in a typical day?
5 or 6.
How many standard drinks do you have in a typical week?
Like 15 or 8.
In the past 12 months, how often have you had a lot more to drink than you intended to?
I don't know. A lot? I'm trying to do better, and I limit the number of days that I drink and how much I drink.
Kelly is in the contemplation stage of change. She is trying to make a change, but she is not yet sure how to do so effectively.
In the past 12 months, how often have you been under the influence of alcohol in situations where you could have gotten hurt or caused an accident?
I don't know. I got really drunk at an office party, which was pretty embarrassing. No one let me drive. I guess if I had driven, that would be one time.
Is it okay if we talk about your substance abuse?
I guess so.
Your alcohol use is above safe limits, and I'm concerned about how that affects your health. I would like you to consider cutting back.
Well, I've tried cutting back by only drinking at certain times on the weekends, or just 1 or 2 on the evenings each week, but I haven't had much success. It isn't going very well, though, so I'm not sure what to do about it.
Do you feel you're ready to take steps to make this change in your life?
Yes.
On a scale of 1 to 10, with 1 being not ready to make change at all, and 10 being that you are actively in the change phase, where would you rate yourself?
I rate myself maybe at a 4.
You rated your readiness at a 4. Why not a 2 or a 3?
Well, I've tried a few ways to change, but I've not been successful. I feel I am at the point where I want to change, and I don't really know how. But I'm open to any suggestions and help from others.
The nurse and Kelly are using the self-evaluation ruler to determine where Kelly is at on the readiness to change scale.
What would you like to see different about your current situation?
This is an example of an open-ended question. The nurse is trying to elicit or evoke change talk with Kelly.
My drinking has caused me to make a fool of myself in public situations. When I don't drink, I have tremors and sleepless nights. I don't want to be a laughingstock, and I want to feel fine whenever I'm not drinking.
What will happen if you don't change?
I feel I need to change because I'm on the verge of losing control. If it gets worse, it will cause problems at my job, my friends, and my family. I don't want to lose my job or make my parents ashamed of me.
What is a pro to changing your drinking?
I don't really know.
Alcoholism can lead to severe health issues like liver damage. It can cause legal issues, such as DWIs. If you quit drinking, you would be less likely to have employment problems. You would save the money you're spending weekly on alcohol. DWIs and legal fees are also very costly. Not being drunk gives you a clear mind and keeps you from impairing your friendships and saying things when you are cognitively impaired.
The nurse is trying to enhance motivation in Kelly to get her to see what good aspects can come from making a change in her disease. She is developing discrepancy by getting the patient to see how her life will be positively affected by making a change.
Those are good points. I never thought of it like that.
How does your family and friends feel about your drinking? Have any of them commented on this subject to you?
Well, some of my colleagues have made remarks about the way I acted at the office party, but I don't really remember that night, so I blew off the comments. Sometimes my mom will make remarks to me about how I should slow down, but nothing really beyond that.
How does that make you feel?
Well, I never really thought about other people's comments before, but now that we are discussing this, I think people would support my decision to cut back.
It's really brave of you for coming in and talking about how you want to change this aspect of your life.
The nurse is using an affirmation to recognize her willingness to change.
I'm scared and nervous that I won't be able to change on my own. I feel like I've been doing things and to try to change, and I continue to fail at them.
I understand this is a very difficult time for you and very scary. It can be scary to change your life and suffer the withdrawal symptoms that you are currently having, but you know that your life will benefit from controlling your alcohol use. Having your friends and family support you during this time can be extremely helpful. It is okay to be scared. You have already conquered the hardest part of this disease, and that is making the decision you want to change. Are you open to letting others help you change?
The nurse has reflected the patient's feelings of being afraid to show empathy. She summarized why the patient is afraid to transition to the next topic.
I'm willing to hear about my options.
There are websites with resources such as the National Institute on Alcohol Abuse and Alcoholism, the National Clearinghouse for Alcohol and Drug Information, and Rethinking Drinking. There's also AA if you want a support person to guide you.
I've heard a few groups such as AA, but I'm a little intimidated by it.
What is it that intimidates you about group meetings such as AA?
I feel intimidated by the fact that I would have to admit my problems in front of a crowd of people I don't know or trust. I feel like maybe they would be judgmental about the things I've done.
So what you're saying is that you feel like you would be judged by those in the group?
Yeah, I mean, I don't want anyone to think less of me.
Those groups are helpful because everyone there has gone through the same thing. They understand what you're going through and can be a great support system for you. They can emphasize with you better than someone else who has not been in that position. They probably all felt the same way when they started. Would you be willing to talk with someone who has successfully completed the AA 12-step program? We could have a sponsor contact you just to discuss what the program is about and to get more information. It can be completely anonymous. We can just give her your first name and have her contact you by phone if that makes you feel more comfortable.
I think I would be okay with that.
If you decide to participate in AA, you will have a support system like that available to you at all times. They can help you through the hard times and help you to remember why you started this program in the beginning. They will enable you to be self-sufficient in your recovery. You have already accomplished a lot in your life. I think you're up to this challenge.
The nurse is supporting her self-efficacy and ability to make the change autonomously. Now it is up to the patient to continue with the treatment plan that was already laid out.